before we start and dive into the topic, let's go through these objectives. First, to understand the calcium metabolism. Second, to apply the knowledge of the calcium metabolism into the clinical practice. And third objective of today's discussion will be to differentiate between the different forms of hyperparathyroidism. Good? Good. Excellent. I hope that you enjoyed the pre-recorded lecture. So before we start, let's go over this question. What is the rate-limiting enzyme in vitamin D activation? Who fought for one? Everyone. Excellent. This is the right answer. Good. So now let's dive into the topic and we'll discuss this case scenario. Before we start discussion, let me distribute these two poster papers, and each group can use it during the group discussion. So we have a 57 years old who is found to have elevated calcium in his blood before laparoscopic cholecystectomy for symptomatic gallstones. So this high calcium was found incidentally. He denied any history of bone problems, kidney problems or kidney stones, neuromuscular or behavioral problems. No family history of similar problem. Examination reveals blood pressure of 120/70, heart rate of 100, and no palpable neck mass, and the rest of his physical examination was unremarkable. Okay, so I need you now, each group, to draw or create a simplified diagram about calcium physiology. I will give you 5 minutes. Each group can draw this diagram. Good. This is the calcium physiology, and as you can see, in response to low calcium, the parathyroid gland produces parathyroid hormone. This parathyroid hormone has two main functions. First, it stimulates osteoclast in the bone to release calcium. Second, it activates the vitamin D from 25 hydroxyvitamin D to 125 dihydroxyvitamin D in the kidney in order to increase the calcium absorption from the small bowel, and also it increases calcium reabsorption from the kidney and decrease phosphorus reabsorption from the kidney. So to simplify this, the low calcium will stimulate production of parathyroid hormone. This parathyroid hormone has two main functions in the bone and in the kidney to release calcium here, in the kidney to activate vitamin D, and to increase reabsorption of calcium and decrease reabsorption of phosphorus. This activated vitamin D will increase absorption of calcium from the small bowel. Excellent. So everyone now has full understanding about this physiological sequence that result from low calcium. So back to the case now. What's next? So you have this patient who is totally asymptomatic, only he has high calcium. What do you do? Based on this, what do you think you're gonna request for this patient? Excellent. So you're gonna request calcium, phosphorus, vitamin D, and PTH. What do you think this patient has? Let's see. This patient has calcium of 12, normal vitamin D, high PTH of 90, the normal value up to 65, and low phosphorus. Okay. So what do you think the most likely cause of this patient hypercalcemia? Hyperparathyroidism. Okay, we have different forms of hyperparathyroidism. Which forms do you think? Let's go back. So we have high PTH and high calcium and normal here vitamin D. So this patient totally fine, totally normal, asymptomatic, has no chronic medical problems. So this patient has primary hyperparathyroidism. Right. So how to differentiate between primary hyperparathyroidism from secondary hyperparathyroidism? So we know now there is hyperparathyroidism, and the cause of this hyperparathyroidism or high PTH level is primarily due to parathyroid gland tumor. That's why we call it primary. Okay, so what do you think secondary hyperparathyroidism is due to? Okay, yes, low calcium. Low calcium is the cause of the secondary hyperparathyroidism. Okay, so the secondary cause of high PTH in some patients can be due to low calcium. That's why parathyroid glands acting up to compensate for this low calcium level. Okay, so here a secondary hyperparathyroidism, which is usually due to renal failure. In renal failure patient, there is impairment in vitamin D activation and impairment in calcium reabsorption. So there is calcium loss and there is impaired activation of vitamin D, which results in high PTH. All right. So the homework for you today, I need you to do a journal entry in your blackboard. In this journal entry, you're gonna answer 3 main questions. First, define tertiary hyperparathyroidism. You remember we discussed primary and secondary. And I need you now to define tertiary hyperparathyroidism. Second, I need you to generate a case scenario of a tertiary hyperparathyroidism case. And last, compare and contrast between the primary and secondary and tertiary hyperparathyroidism based on what we have learned from the physiology here. Thank you.